Thanks, Emily, and thanks to Emerging Minds for hosting the webinar. So I'm an academic at the University of Manchester. I'm also a child and adolescent psychiatrist. I work at the Royal Manchester Children's Hospital and run a clinical service there for children with autism spectrum disorder. So next slide, thank you. So I'm just going to run through some things. I'm aware that the audience is a mixture of professionals caring for people with autism and also parents of children with autism, and perhaps also some autistic people themselves, perhaps adolescents. So I'm trying to bear you all in mind with what I say. Different bits of the presentation will perhaps be more focused to each of you. So as James has said, and you don't need me to tell you this, it's been an extraordinarily disruptive time for us all around the world. But we particularly thinking about the disruption for autistic people and their families. The rapid removal of all the normal supports that have allowed family life to go on, schooling. Although in the UK here we have provision for SEND pupils to attend mainstream schools, a lot of the specialist autistic schools have actually closed or are not functioning, and so paradoxically some of our more impaired young people have suddenly lost their school life. Life's constrained to the immediate family with loss of normal routines. All of this you're only too aware of. And what's the task for all of us is to maintain meaningful family life in these extraordinary times, and the fact that this is going to go on for a bit. Yeah, so matters of resilience. Of course, this is a universal experience for everyone around the world, and that may actually paradoxically help a bit in terms of a feeling of that we're all in it together. But of course, that sharing is unequally distributed. Some people have much less resource than others, and we need to totally accept that. I want also to recognize, and I think this is really important clinically, that families come into this time with existing strengths and strategies. And partly it's a matter of helping families identify this and to help them adapt those existing strengths into this new situation, preserving the values that they hold dear for their family life and their children. What social networks have we got, and how can we disseminate these to support? All these are questions I hope we can discuss. And I also think we need, in a policy level, more of a specific focus on the environmental conditions we can put in place to help our families. What I've called a COVID autism plan, and we haven't really got that yet, and I hope that we can maybe talk about that a bit more as we go forward. What do families feel and want? Well, some colleagues from the University of York have recently, literally last couple of days, published some first results of questionnaires from families across the UK. I know that some of these colleagues are on the call, so congratulations for them to doing this work with over 250 or so families. I just want to point out that in the top section there, it's about what families are really concerned about at the moment. And it's parents' own worries come very high. And of course, these are parent reports. They're clearly worried about their own children's worries and behaviors. Some are feeling overwhelmed, but around about 20% or so are really feeling overwhelmed. And about the same number actually feel it's been net positive, at least for the moment. What do they want to see? Well, they want to have access to specialist autism-specific advice, and I'll come back to that a bit more. They want communication aids and educational activities and practical help and some safe outdoor space. All these seem eminently practical things to want, and it just highlights for us where we have to be focused, I think. I'm going to just address some key areas, hopefully in a reasonably practical way. This is primarily addressed to parents, but also would be to young people with autism themselves. But of course, for professionals, these might be domains in which you might like to address how your families are doing and review with them. So domains of communication, routine, calming, and crisis is how I've sort of conceptualized it to touch on these key areas. They're pretty common sense, but what's worth emphasizing, of course, is that although this seems fairly common sense, to actually achieve this in the current times is a real challenge, and we totally recognize that. So communication. This is clearly the key foundation for managing things during this period. We all know that for autistic children and adults, the disruption of ordinary routines and predictability around which they so much kind of hang their emotional life can be really deeply disorientating and produce deep anxieties and distress. And this is one of the key things that we need to be able to address through communication. Before that, one needs to remind all of us that good care starts with self-care. In other words, parents and other adults who are in a caring role need to look after themselves, because until you feel reasonably looked after, it's difficult to look after others. Then there's the issue of really understanding your child's perspective at this time. And this is not straightforward. Anyone who has an autistic child or is autistic themselves knows that the way of understanding what's happening will vary hugely between children, of course, and can be really difficult to articulate and make sense of. And this is why I think you need to take plenty of time and space to listen, communicate to your child, and imagine what they must be experiencing at this time. And you'll know your child best, and you know how best you can normally communicate. And all I would suggest here is that taking the time and space to do this is key. When we get anxious about what's going to happen, sometimes this kind of taking time and space can get lost in the anxiety of just doing the next thing. But it really is a key thing. If your child feels heard and understood, it'll settle them hugely. And then there's the question for them in these unusual times of continuing to feel secure, that they're in a reliable and consistent environment. And this is really how you model that through your own actions. No one's perfect, particularly in a situation like this, but one's aware that just the way you behave every day is going to communicate itself non-verbally to your child. It's going to set the atmosphere. So these are the key sort of facets. It's common sense, but hard to do at this time. There are resources that we have. There's some lovely resources online, for instance, which are around social stories and narratives for children of different language competency and understanding around the coronavirus, around why we have to be shut indoors during this time. The Scared Gang series, Scared Gang Have to Stay at Home, is I think a particularly lovely sequence which helps younger and less able kids. And Emily's going to have access to all these resources that you can access after, if you wish. And of course, there is other ways of understanding through action and play. So having achieved a level of communication and allowing your child to feel that they've really been heard and understood in some way in their perplexity, then it's about setting an environment for them that's going to help them feel both secure and reasonably organized. And this is complicated, as we all know, in families at the moment. You've got your ordinary family meaningful daily routine, which is familiar to the child, and then you've got to try and bring in all these other aspects of routine that the child's used to from school, from other activities outside, etc. And in a way, all of this has got to be crowded into this home environment, into the family. And this is, I think, a tremendous challenge and requires organization. Some practical suggestions are that to have a separate space and time for the familiar home stuff and for the school and other activities, as far as possible, to make different learning spaces in the home, as much as you've got space for it, because kids, especially autistic kids, are very sensitive to the environment in which they are learning and communicating. Breaking up the day, organizing the day through a schedule. Visual timetables, of course, are really helpful. One can have alarms set for particular times that helped prompt a change of activity. And then regular times for exercise and activities around the house and outside the house. And again, there are a lot of really lovely resources about how you can do physical activity and other kinds of mental activity, play activity in the home. And we're going to have to really use our creativity here to create an environment which is nurturing for the kids during this time. The issue of screen time is a big deal for many families in everyday ordinary life, and perhaps particularly so now. I guess we might talk about this a bit more in Q&A, but I would certainly, so I'm not going to go into great detail now, but I know it's an aspect that concerns families. But certainly screen time can be really valuable, as well as at times just too much. And perhaps we could talk about that in Q&A. There are many good homeschool resources which can guide you in this, and I've just done a couple of on the slide there. And again, care for yourself in this situation. This is an extraordinary thing that you're doing to try and help the kid through this time. And there's a nice phrase, you can't pour from an empty cup. So looking after your own support's really important. Then, you know, there are going to be times regularly when you're going to need to help your child calm, to settle them when they're getting agitated, to address anxieties, to try and prevent meltdowns and difficulties. And I'm calling this calming, and this is going to be an everyday matter for you with your child, and if you're an adolescent, for you personally. Again, there are some lovely resources there which Emily will have available. A whole load of breathing exercises, other calming strategies that you can build into your child's activity. And I really recommend having a good look through and seeing which of these resources appeal to you, because there are going to be probably things there that you hadn't thought about, or at least you can say, oh, that's a nice one. Maybe I could use that and try it out. We're going to have to be doing things that we're not used to here to get through well. So there are some lovely calming strategies for home that have been recommended. And then there are going to be crises. And these are the things that I think usually cause parents most worry. It's like, oh my God, what's going to happen when my child melts down? It's going to get too much. There's going to be dangerousness. He or she's going to be hurting other children or themselves. And the fear of a meltdown is often a big part of everyday life and stress for parents. Again, there's this is, on the one hand, it's not rocket science. On the other hand, is extraordinarily difficult to do in practice. And I just put here on the slide the behavior volcano, because I think this is quite a nice way of conceptualizing what usually happens during meltdowns, particularly for young kids, but also it happens for adolescents too. The build up from the trigger points into a raised anxiety to a point where the behavior is escalating, into a point where it's got beyond, as it were, the point of no return, and it's what we usually call a meltdown, or whatever term we want to use. And of course, there are different strategies to take during each of these phases. And it's really helpful as a parent to get an idea, where am I on this slope? What can I do at this particular point? There's early redirection strategies, what we think of as primary prevention. Then when it goes up the slope more, there's actually getting other members of the family into a safe space, maybe isolating the child a bit more from others. And then to the top of the slope, it's about reducing too much interaction. When a child is in this state, as many of you will know, there's no point really trying to reason with them, talk to them, because they're beyond hearing that. Their arousal is just too high. And then right at the top of the volcano, this is about keeping everyone safe, some therapeutic safe holding, some provision of the child to have safe space if they need it, etc. And having a strategy that you know you can roll into when you need to, so that you're not taken by surprise and panicked by it. And these things end, they come down, and then it needs to be about managing the afterwards, looking after the child, reassuring them, and keeping them back to their baseline function. This is going to happen maybe several times a day for some of you. This is hugely exhausting and demanding, but this is the work that keeps the child going and keeps the family going through this time. And us specialists, we know, because we are working with you and trying to help you during these times. And it's often these moments when you need specialist support. But what I would say is that everything I've said in the previous slides, of course, if done well and effectively, will hopefully head off these. So it's all about starting from the beginning with the communication and the routine setting, and those hopefully will minimize the amount of times that we have these crisis moments. So finally, coming to specialist services, what can we offer during this time? Can specialist services go online? And we are already been moving towards this a lot in the CAMS field, and COVID is only going to accelerate that. So for instance, my clinic in Manchester, we've moved completely online really now, both in most of our assessment work and our therapy work. For a time, we've been doing therapy with for parents and children online very successfully, really. So, and there's a lot of interest around the world in so-called telemedicine or remote working. Lots of people have published preliminary stuff. And I would say that the preliminary experience that we've had as therapists, of clinicians, is overall positive for what one can do using this if one's creative. We have, in our service in Manchester and with colleagues in the UK, remotely delivered parent-mediated interventions in a more formal sense. That's also been done in the USA. But what I would say from an evidence point of view is that this is early days, and we've got lots of positive reports, as it were, and hopeful signs, but we need some more systematic studies of whether this kind of remote working is really as good as face-to-face, and that's going to be important going forward. So that's all I'm going to say. I'd just like to thank members of my clinical and research team in Manchester and others who've supported me in this, and there are some resources down at the bottom there, and as I said before, Emily's going to have more on the Emerging Minds website for you after. Thanks so much.
Thank you very much for joining us for this recording from one of our Emerging Minds webinars focused on how we can best support children and young people during this time of COVID-19 and what research can offer us. We are planning a range of webinars and you can find details of those on our website. And please do also get in touch to let us know what subjects are on your mind and what you'd like to focus on next. So a quick word about Emerging Minds. We're a research network funded by UK Research and Innovation, and members come from all sorts of disciplines and sectors, but we're all working towards reducing the prevalence of mental health problems experienced by children and young people. We really invite you to get involved, so please do sign up to keep in touch with our newsletter via our website, or keep in touch on social media, for example, Twitter. We also wanted to talk to you about a survey we are running at the moment called CoSpace. So we want to learn how families are coping with the challenges of COVID-19. So if you're a parent or a carer of a child in the school years from 0, so reception and foundation, to 11 in the UK, please do consider taking part. And your responses will really help us to find out how children, young people and their families are getting on, what's working for them, and how we can best help. Please do also spread the word to your networks and colleagues too. You can see there some of the findings that we've shared so far from the study. And on our website, you can find resources particularly for parents and carers and people that work with children and young people, like the one here on the screen, about supporting children and young people with their worries. Thanks again for listening, and we hope to keep in touch with you. All the best.